Right. So how are the things going on? Good. You will get your assignment marks very soon. Hatim හොඳට කරලා තිබුණා. That's නිසා කටියරු. දැන් අමාරුයි. අපරාධ ගෲප් එකේ මෙසේජ් එකක් දෙන්න. It's slowly ගියේ. Saya happy dengan pusing dia tu. Ya. Taiwan. Expect like missing no. Right. Maybe because no, in the morning you are having here in the morning, right? Right. Morning it wasn't raining. Maybe celebrating election results. Probably. Did they contest for the election? Any Pradesh of our country? Right. This is that issue is there right from time to time is coming and going. These are the cable. Would it be anything? Oh. But I think it was it was fine. It was fine. You I gave me, right? Yeah. Right. So then we have come to the final part of this. Is it about the cable? Signal is coming and going. They are reading by right. Okay, clinical biochemistry. This is not a hard part. Okay, this is not a hard part. So here we talk about the basically the tests, the biochemical tests which we are doing about like blood tests and all those stuff, right? So right, let's start with the most common one, blood sugar test. So I think every one of us, we have done blood test at least once in our lifetime, right? For certain reasons, like we take blood sugar test, right? When we get sick, like to check whether we are in normal situation, right? So blood sugar, when we say blood sugar, that is about glucose, right? Glucose. So glucose metabolism we talked about before, right? So how glucose is coming into the blood and how it is happening. So glucose is coming in. So that part we have already discussed. And about diabetes side also, like we discussed. Then when it comes to so this blood sugar test, this is about how much glucose is present in the blood. That is blood sugar test. Right. So then it is really important to find out about the blood sugar content because then we know whether we are in diabetes situation or not, right? So then this side is this area of chemistry, we call it clinical biochemistry. These are all lab cases, all lab tests, right? When it comes to lab tests, we know it's all about like, so some sample has to be collected in blood test, yeah, blood sample, urine sample, serum samples. Likewise, the sample should be collected. Then it is taken into the laboratory. In the lab only, all these tests are being done. Well, so when it comes to blood test, right? Blood sugar test. Blood sugar test is done in different ways. You have heard about fasting blood glucose, FBG, right? Fasting. So in that case, well, then we have to wait for 8 to 12 hours without eating, right? Then we measure. So then, there is no point of measuring the blood sugar level, blood glucose level while eating, right? It is just like we are while wearing dirty shoes and walking here and sweeping the floor, something like that. So there's no point, right? There's no point of doing that. So then, for us to measure the exact amount of glucose present in the blood, we have to stop supplying glucose into the blood. That is why we stay without eating, right? We stay without eating. Well, we have to fast 8 to 12 hours, right? And when we measure, final reading has to be, it can be measured in milligram per deciliter or millimole per liter, right? So those are the units, right? If you can remember, like a blood glucose report, you get the table, report tag, anything. A table reference ranges, right? Not only glucose, any kind of a test, like we get a range. Well, so in healthy range, 70 to 99, that is a range, 70 to 99, right? Well, So in case, so how do we say that we are suffering from diabetes? Then it has to be, the level has to be, some water is coming over there, right? Service. Service. Not related to this video is coming in, doing something. No, related to that. Related to that. Yes. Ah, yes. Right, right. Right. Earlier we used to use the TV also before this game. Right. Okay. So anyway, if the glucose level is greater than 126 milligram per deciliter, in millimole, greater than 7 millimole per liter, in that case, we consider that the particular patient is suffering from diabetes. That means high glucose level. But remember, just with one reading, we can't do that. Right? Two separate readings. These readings, these values, the values change. Think about that, okay, for a test, okay, you are excited, right? Frightened, like, sometimes, some people don't like, they are scared at those needles and stuff, so then they get scared. Right? So then in such cases, our internal metabolism becomes changed. In that case, it is difficult for us to get a high, like, accurate reading. That is different. Under the normal conditions. Now, actually, we just sit and relax our normal situation, right? When you're excited and frightened or something like this, some emotional situation, then these internal chemical situations are definitely going to be changed. In such cases, with one reading, we never judge that, okay, this fellow has diabetes. No, right? Two separate readings, independent readings. Then only we know, right, okay, for sure, diabetes has to be greater, equal, or greater than 126, right? Well, that is fasting blood sugar, right? Random blood glucose, random blood glucose, right? Random blood glucose, in this case, there is nothing about fasting. We eat, right? So then, while we are eating, okay, there is a glucose intake and there's glucose consumption. In and out, both are there. Then, right, all of a sudden, right now, let's say we take a blood sample and we go for glucose test. In that case, what is happening? In that case, we get an idea, right? Okay, while we are eating, then normal way, like while we are taking glucose in, while we are consuming glucose, also the in and out both are there. How much glucose is available remain in the blood, right? That is what we call random blood glucose, right? So then there's nothing about fasting. In such cases, in the normal situations, like right now, in that case, if we have more than 200 milligrams per deciliter, in that case, that is referred as, okay, now we are suffering from diabetes. That is random blood glucose. Right? No fasting. Right. Another one. Another oral glucose tolerance test. Well, this is how we do that. Okay, we eat fasting. After that, we give 75 grams of glucose dose, right? Fasting. And we give to the patient, we are giving 75 grams of glucose. Right. Then we wait for 2 hours. We wait for 2 hours. Then we go for the blood test, glucose test. Now, in this case, what are we measuring? Now, all of a sudden, like we know, when we eat, the glucose level increases. Glucose level increases means then insulin has to work on that to reduce that, right? To find out that process, how fast and how efficient that process, that step is. That is why we are doing this test, glucose tolerance test. That is DQ. Okay, glucose DQ. Now, body has to react on that. No, body can't let the glucose concentration in the blood to go up, right? It has to be maintained at the right level. It can't go up. But, so then if it doesn't go, like basically, when we give glucose, it has to be taken down by insulin, right? Uh, to find out whether this is happening or not properly, we do oral glucose tolerance test, right? OGTT. So after 2 hours, it has to be less than 140 milligram per deciliter for a normal person. Okay. Now, is everything clear about the three tests? We talked about 3 times: fasting, random, and glucose tolerance test. Okay. Right. So these three are done for 3 different purposes. Right? That's glucose. Food name. Assignment clear. Finish cat food car. Finish assignment clear. It can make out. Yeah. Was it you? Oh yeah, there was another one. Oh. Right. Okay. Now this, of course, now like I told you before, these tests are like, accuracy cannot be guaranteed. Like all of a sudden we do this and but accuracy cannot be guaranteed. So we do the test over like 3 months, right? 3 months, right? Normally, clinically for some tests to be accepted, like so there has to be ranges. The value should be there within the range. So then blood glucose level also, right? We measure over a period of 3 months, right? Right. So this is all this related to monitoring for monitoring diabetes, right? So then diagnose cutoff means that means like when we keep on measuring the blood glucose level over 3 months, right? It should be uh, diabetes level. The range is going to be 6.5%. For everything there is an like expected value and the value expected. There's an expected value, right? There's an expected value, but we are getting this value. Then there's a difference between the expected value and the true value that we get in the experiment. The difference is the error. Difference is the error. Then, for us to consider this as a fault of the body, for us to consider this as a problem, the range, the maximum amount has to be 6.5%. Right? It could be changed within the range of 6.5%. Right. That is glycated hemoglobin. Right. Well, so those are the reference ranges and all those stuff. Can you talk about the clinical side of this test? To the test, right? What do we collect from our body? That is what we call sample, right? Blood. When we take the blood sample, we don't like put the needle inside the body and take blood from the arteries, no, right? Always we take the blood from the veins, not from arteries even. Like arteries we don't touch unless it is surgery. Otherwise we won't. Veins only. From the veins only we take blood. Blood, plasma, serum, right? Okay. We take. Well, and we definitely have to consider these factors. You should know these stuff. Whether we are fasting or not, and whether the patient is under stress or not. Right? In your career, definitely you will be meeting such cases, right? When you analyze the situation, right? when the patient, if the patient panics, right? Then all those reports you have to take into the consideration. Then you have to make a special note on that, right? Then how it is happening. That is how it's happening. And the medications. Definitely, the history of the patient has to be analyzed. You know, when now you all don't go to doctors that much, no. Now, beyond your age, when the people go to the doctor, you might have seen, they carry a big book, right? A big book. The book has the history, the medicines given over a period of time. In the book, only the doctor writes the next prescription, right? Like that. So the history has to be there. Then medications. What medications are being taken? Very important because without knowing, we can't just read a, when you take a medical report, blood sugar report, don't ever think that, okay, you download the reference ranges from Google and compare that and diagnose something. Never, right? So that is malpractice of knowledge. So you can't do that. So definitely you need to talk to the patient and figure out these situations, right? And then you have to adjust and you have to have the knowledge to think that, right, under this situation, okay, so then this range might be high up to this extent or will be low up to this extent. That will be there, right? So medications. And also, sample handling can affect result. Sample handling. What do you mean by sample handling? You might have heard the story. Yeah, it happened. A very famous story. Martha, I think. Yeah. Yeah. Hospital was Archie Hospital, there's branch. Yeah. And a man has admitted his mother to the hospital. That lady was around 75 years or something. And so one report, so one of the tests which was carried out, one was a urine test. And the urine test report came as the lady is pregnant. And finally, he blasted the entire staff, and finally, he got money also, like big compensation, and threatening that I will go to courts and stuff like that. So, handling the sample, right? So, then that is very important part, right? Samples can be mixed up. So, then samples should be labeled, right? So, samples should be properly labeled. So, and handling the sample in sense like there is a way that we have to keep the sample, like, store the samples. In some cases, we have to keep the samples at this particular temperature, certain temperature. Some cases, room temperature. Some cases, warm conditions. In that case, warm up to what level? Right? So, handling the sample is really important. Well, so those are the lab side of that, the clinical side of that. Well, so how do we do this? To do the blood test, these are the stuff that you need. Chloride oxalate, or plain test tube, right? Fluoride oxalate test tube or plain test tube. So that is for the serum sample, the plasma sample. Okay, right. And glucose oxidase reagent. What is this glucose oxidase reagent? We are testing for glucose. Glucose can be oxidized, right? Glucose can be oxidized. Then we oxidize glucose and find out how much reagent was required for the oxidation process. Then only we find out what was the content of the sugar inside. We need distilled water, test tubes, pipettes, colorimeter, and so colorimeter, okay, spectrophotometer, That is to check with the reference rates of the we take the sample. Right. Timer, test tube break, and control samples. Right. Control samples, when we say control samples, we have control normal glucose level sample. Right. Normal sample, that means normal reference range. And the abnormal levels. Right. The two edges. Very high glucose level and very low glucose level. Right. These are the stuff that we need for carrying out this experiment. Well, right. So, how do we collect the sample? Like I already said, not from the arteries, but from the veins. We collect 2 to 5 milliliters of blood. And we need to make sure that the needle is sterilized properly. Right? Needle is sterilized properly. Otherwise, what will happen? If the needle is not properly sterilized, the germs will go in. Right? The germs will go in. And then, right, now we take the tube. Right? Test tube. Or the fluoride oxalate tube. Right. Now, if the sample is in this tube now, we label it. Right. Do you know the process called centrifuge? Emma. Mema. අපි දැන් ගත්තට පස්සේ දැන් ටෙස්ට් ටියුබ් එක. මේක තියෙනවා බ්ලඩ් සාම්පල් එක. දැන් බ්ලඩ් සාම්පල් එකේ ගත්තට පස්සේ ඕකේ තියෙන කන්ටෙන්ට් එක ඕකේ ගොඩාක් જાති දීලා තියෙනවනේ. නේද? බලමු මොකක් වෙන්නේ නැද්ද? බ්ලඩ් ඇතුලේ තියෙන දේවල් ගැන අයිඩියා එකක් තියෙනවනේ. නේද? white blood cells තියෙනවා. ඒකේ හීමෝග්ලොබින් පාර්ට් එකක් තියෙනවා. හීමෝග්ලොබින් වල අයන් පාර්ට් එකක් තියෙනවා. අන්න ඒක heavy. Right? Right. So we need to separate what is inside has to be separated. Most heavier ones down, most lighter ones on top. Right? ඒ කියන්නේ දැන් blood sample එකක් ගත්තම සෝමියෝ තියෙනවා. නෑ ඒක fully mix හොඳේ. එම blood sample මේ bottle එකකට ගත්තා කියලා හිතන්න මේක uniform solution එකක් තියෙනවා. ඔය ඔක්කොම එක එක තමයි ලස්සන දේ mix වෙලා තියෙන්නේ. Now in the lab what we are doing is we are going to deposit, right? We are going to take the heavier ones down, lighter ones after that, lighter ones after that, lightest one on top. Right? To do this, what do? We rotate this. හරි. ඒකට අපි ගන්නවා rotate කරන්න මෙහෙම මෝටර් එකකින් ඔම අලුත් දෙයක් නෑ මගේ. මෙහෙම ලොකු මේ වගේ ඇක්සල් එකක් තියෙනවා. ටෙස්ට් ටියුබ්ස් ටික මෙහෙම එල්ලන්න මෙහෙම දාපු කොක්කක් විතර මෙහෙම තියෙන කොකින් ටෙස්ට් ටික එල්ලන්න පුළුවන්. දැන් ටෙස්ට් ටික මෙහෙම තියෙනවා. වටේ හිටුව මේක ටෙස්ට් ටියුබ් එල්ලන්න පුළුවන්. right. දැන් මෝටර් එක ඔන් කරාට පස්සේ මොකද වෙන්නේ? ටෙස්ට් ටියුබ් එල්ලලා තියෙනවා මේක ගැරටෙනවා. හරිද? ඇක්සල් එක ගැරටෙනවා. දැන් ටෙස්ට් ටියුබ් මෙහෙම තියෙන එක දැන් මේ ස්පීඩ් එකකින් ඉන්න මොකද වෙන්නේ? ටික ටික මෙහෙම වෙනවා. ඊට පස්සේ මේ ඇන්ගල් එක දැන් මේක ගැරටෙනවා. right. okay. high speed ගැරටෙනවා. For 1 minute, 300 rounds, 300 RPM. RPM means rounds per minute, right? So it's making very fast. Okay, entire gadget is rotating very fast, right? This is what we call centrifuging. All right, not a huge thing, just rotating. Okay, just rotating. එක විනාඩියකට round 3000ක් කරකැවෙනවා. Right. With that speed, what is happening? Heavier ones sink down and lighter ones remain. Right. So that is a centrifuging process. we do that for 10 minutes. Right? We do that for 10 minutes. Like that, but blood report එක ඔය අපි මේ ඊළ blood sample එක දුන්නා හදලා report එක එනවා එකක් නෙමෙයි. හරිද? ඒ කියන්නේ ඒවට computer methods උත් නැහැ. blood sample එක දාලා ටික ගාලා report එක ගන්න එහෙමවත් නැහැ. right? මේ process එක යන්න ඕනේ, centrifuge කරන්න ඕනේ, වටේ කරකවන්න ඕනේ. then අර ටික deposit කරන්න ඕනේ. වැඩ ගොඩක් තියෙනවා. right? then only so then centrifuging part is done. Right. After that, now we take, remember we were talking about the glucose oxidase reagent kit, right? Now we add that oxidizing agent. But remember that room temperature has to be there. The temperature must be there. Then, okay, that is our blood sample. Separately, we prepare a standard glucose solution. What do we mean by standard solution? Remember, a standard solution is a solution with accurately known concentration. A standard solution is a solution with accurately known concentration. Another, glucose, right? A glucose solution, standard glucose solution means in 1 deciliter, there has to be 100 milligrams. That is a standard solution. It's a reference. Blood sample. Simple. Right. And the distilled water and a blank one. But they are hammer test take a deliver distilled water. Take a blank solution. So take a compare and no blood sample. That is the test to say. Right. Okay. Then now we have 3 setup. We take 3 setup. Blank. The blank one, reagent and distilled water. Standard solution, reagent and glucose, standard glucose solution. And our patient's blood sample, reagent and the blood sample. Right. Right. So why do we, so what is this reagent? Reagent is that oxidizing agent. Okay, the glucose sample is going to be oxidized. Those are the 3 experiments that we do. The 3 tests that we are going to have. Right. Let's say that you hand over your blood sample to the lab. Right. In one test tube, we have glucose reagent, distilled water, right? And the other one, standard one, that's a blank solution. Glucose reagent, standard glucose solution, nothing. And our real blood sample, glucose reagent, and the blood sample. Those are 3. Then whenever we hand over a blood sample, these 3 are being done. Right? These 3 are being done. Okay. Once it is done, what do we do? We go for incubation. What is incubation? Have you heard about incubation? Incubation. Incubation කියන්නේ මෙහෙම එකක්. දැන් හිතන්න දැන් කොහොල විතර දැම්මත් පස්සේ අර විතර නකිනවනේ. විතරේ උඩින් වාඩි වෙලා ඒ ටෙම්පරේචර් එක දීලා අන්න incubation. දැන් ඒ ටෙම්පරේචර් එක නැති වුණොත් ඒ විතරෙන් පැටියෙන්නේ නැහැ. දැන් incubation කරන්න නැති වෙලාවල් වල තමයි අපි අර දැන් කුකුලා මේ විතර අර එක තැනක තියලා අර බල්බ් එකක් ෆිලමන්ට් බල්බ් එකක් දාලා ඒ ටෙම්පරේචර් දෙනවා. හරිද? අන්න incubation. Right? Incubation. So here what we do, incubation is done. That means after doing all this, they find as a final step, like we mix all the test tubes. After that, temperature is brought up to 37. That's temperature. 50 minutes or at room temperature for 30 minutes. That is based on the kit protocol. That is kit protocol. I was talking about that glucose can be oxidized. Glucose can be oxidized. So this glucose oxidation, that sample, that kit, right? That mentions always that mentions that okay, these are the instructions to do. So depending on what instructions are given, we supply 37 degrees Celsius for 15 minutes or room temperature for 30 minutes. All right. Right. So this is how we do. That is the incubation part. After that, we take the measurement. Right? We take the measurement. What measurement? We go for like spectrophotometer. In that case, now we have three, no, blank one, standard one, and the real blood sample. Those three. Then we take the absorbance value, right, by using spectrophotometer. And that is giving us the frequency, the wavelength, frequency, wavelength, both are, right? So I have mentioned wavelength here, 505 nanometer. That is the wavelength range that we are supplying, right? Then we take the measurement. Final calculation is done like this. අපේ blood report එක print කරලා එන value එකේ මෙන්න මේ calculation එක කරාට පස්සේ. Right? Okay. Absorbance of test. Test කියන අපේ ඇත්ත blood sample එක. Patient ගේ blood sample එකේ absorbance එක. Divided by absorbance of the standard. අර අපි ගත්ත test tube තුනේ මතක දෙකක් standard නේ. ඒකට අපි blood දැම්මනේ අපේ concentration එක හරියට බදාන්න glucose solution එක විතරයි ඒක දැම්මේ. Glucose solution එකයි අර oxidizing agent එක. Right. That was absorbance value into the concentration of the standard solution, which is this. Right? Right. When we do this calculation, only the blood glucose level, the printed value, that printed table is coming like that. Right? So this is how we do glucose test. Clear? Easy. Okay, all be ready, right? Right. Okay. Precautions. While we are doing, if you are handling this test in the lab, so how do we, what are the precautions that we should do? Gloves. It's a must use gloves. And follow biosafety precautions. Biosafety precautions. We are using gloves, and so it's like this. One thing, our blood sample should not be contaminated. We must make sure that from our hands nothing is going in. Plus, We don't know how harmful that blood sample is to us, right? In that case, it is a must that we should be protected. The hole should be there, right? So then it is a must to use gloves. And also, for everything, there's an expiry, right? The reagent, that oxidizing agent, what we are going to do in this experiment, what we are doing is exactly we are oxidizing our blood glucose sample. Then for us to do that, we need to make sure that the reagents that we are using for this experiment, they haven't exceeded the um, expiry date. Right. Other thing, we should mix the reagents gently, and the bubbles should be avoided. Let me talk about this. So, uh, what we are talking about, what we are doing in this experiment is we are oxidizing the glucose sample, blood glucose sample. When we mix the reagents, just let's say that we just pour the liquid, we just pour the reagent, then air bubbles will be trapped inside. What's going to happen is if that air bubbles also contain oxygen, normal air, that will be our glucose sample will be oxidized, uh, not by the reagent that we put, but by the atmospheric oxygen. Then bubbles shouldn't be allowed to form. Right. Calibrate the spectrophotometer before reading. You know, our instrument, as an example, but it's this calibration part. That means when we are taking a reading by using some kind of an instrument, the instrument should be right. Let's say, okay, you want to measure your body weight. You get onto the scale, but what if the scale already has some reading? It has to be 0 kilogram. No, when you look at this, if it is 5 kilograms, and you get onto that, it's going to be like wrong reading, right? Instrument. So then before that, you might have practical experience of that. And there's a there's a wheel kind of thing. We can rotate it and adjust it so we can make it zero, the balance. Right. I took the balance because that's little familiar to you. So whatever the instrument, it has to be calibrated. So that is what we call calibration. Right. So then spectrophotometer has to be calibrated properly before we take the reading. Right. That's all about blood glucose test. You know, right. Now we'll come to blood urea test. Blood urea test, BUN, one, right? You must be familiar with this one test, right? Blood urea test. Blood sugar test you would have done, but I don't think you have done blood urea test. Anyone who has done? No. I'm a good test girl, and I feel a little bit, right. Well, blood urea test. Urea. This is urine. So, we check about blood urea test. Remember, we learned from the very beginning, we were talking about separately about carbohydrates, lipids, proteins, those stuff we talked about, vitamins, minerals. In protein only, we had nitrogen in it. But the carbohydrate, they had carbon, hydrogen, oxygen. Right? When it comes to protein, there was nitrogen also. Right? Nitrogen also. Then nitrogen, remember, nitrogen is required for plants. Right? For plants, yeah, nitrogen is required. Urea is required. Nitrogen is required. So during the metabolism of protein, what is happening? Urea is going to be formed. Well, kidney is the one which is attending to that. Right? Kidney only attends to that. Then if the kidney is functioning properly, there won't be high level of urea in the blood. right? In case if the kidney is malfunctioning only, we have a high level of urine. Okay. But so, like I said, urea is a waste product formed in the liver. In the liver. Breakdown of proteins and amino acids, right? So we call that urea cycle. Proteins are utilized in the body. In that metabolism, urea is. But obviously, just like the other ones, blood is one which is transporting this, and it is excreted by kidneys. Kidney is one which is filtering out in the blood. Whatever the process which is happening in the body, whatever the things which are made in the body, that is going to be there in the blood, not in parents. When blood goes to the kidneys, kidney is the one which is removing that. Okay, right. So then by doing the test for this blood test, blood urea test, definitely we can have an idea about how the protein metabolism is done in the body, plus how healthy our kidneys are. If the protein metabolism is happening properly, and if the kidneys are functioning properly, the blood test will be good in the sense, the blood test will be in reference ranges. Right. So we do the blood urea test for that, for finding out whether kidneys are functioning properly. That is called as renal function, glomerular filtration rate. Well, if it is not happening properly, we call that situation acute chronic kidney disease, right? Like in that case, the patients like they have to do dialysis, right? So you have heard about that when the kidneys are not functioning, then that is like hydration status, protein metabolism. So those are the areas which are going to be attended by using this. Our normal range urea 15 to 40 milligrams per deciliter, right? And blood urea nitrogen, it has to be 7 to 20 milligram per deciliter. That is a healthy range. That's a healthy range. Right. This is how we do. When it comes to this blood urea test, there are several methods which are being practiced in the world. One of them is urease method. That's the most common one. It's an enzymatic method. Well, what is happening is now this blood urea. So basically, we are measuring the urea content in the blood. Only do this. We are measuring the urea content in the blood. When it comes to urea content in the blood, the enzyme called urease, can convert urea into carbon dioxide and ammonia. Urease enzyme, because urea cannot be kept in the blood, it's harmful. Then urea is converted into ammonia and carbon dioxide. Right. So that is done by urease enzyme. Well, then what is happening after the formation of carbon dioxide and ammonia? So then they are going to be excreted from the body through urine. That's how it's happening. Well, then what do you do? What we are going to do is we take the blood sample. and we treat that with urease enzyme. What is happening? Ammonia and carbon dioxide are formed. This ammonia which is formed and the ammonia which is formed in that is going to be reacted with chromogenic reagent. Bergman reaction, that's what we call the reaction. Then it is forming a colored compound. Then it's forming a colored compound, right? We take the lab sample, then we add urease enzyme, ammonia is going to be formed, right? Now, this ammonia being another reagent which can react with ammonia to form a colored substance. Then the color intensity we measure. Color intensity we measure. If the color intensity is high, that means there's more ammonia. There's more ammonia means there was more urea in the blood. Clear? Right. That is how it is happening. So then the spectrometer is used. Nanometer value 540 to 578. Right? It depends on the method. So I'm talking about the urease method that we are using here. Right? Another method. Diacetyl monoxide method. That is also colorimetric method. In previous case also we were measuring the color intensity. This is also colorimetric method. Here also we have a reaction between what and what? Urea in the blood and diacetyl monoxide. For us to do this test, remember the medium has to be acid. This is happening in acidic medium. Okay. In case, so why are we doing this? In case, let's say urease and those enzymes are not available, under such situation, we can do this test also. Whatever the test, what are the things that we need? We need our blood sample. And remember, fasting is not a must in this case because it's nothing related to glucose, it's all related to proteins, right? So then fasting is not highly necessary. And we need test tube also. Right. Now let's say test is done. Test is done. And we got the report also. When we get the report, let's say there's a high level of urea. If we have a high level of urea, these are the conclusions that we come to, right? Because we have prescribed something to the patient, isn't it so? And we ask the patient to go and do this test, blood test and come. And the patient goes and does a test and brings the report. Then it's our job to recognize, okay, what are the problems here, and also then we can recognize what sort of problems we have, right? So then in the situation like if the not the glucose, if the urea level is high, renal failure, right, kidney failure possible, dehydration possible. Why dehydration? You know, this is something, this nitrogen containing substances, that is something which is removed through urine, right? Then the composition of urine changes with water intake, right? So then we have to drink enough water so that the urine color remains at pale yellow, right? Think about that we start with a very busy schedule. Think about a day that we are stuck in a very busy schedule and we couldn't drink that much of water. And let's say we stuck in AC also, the body is getting dehydrated a lot. Then urine color immediately changes to yellow, right? Because the contents are going to be high, but to dissolve that, the amount of water intake that we had taken in is very low, right? Right. So that's the thing. Then dehydration, that is possible. right? And high protein diet, high protein diet, high protein. Under what situations? High protein diet, that is a very common situation among young people these days. These gym people, like bodybuilding, right? So they overconsume proteins. Right. Absorbance capacity එක ගැන කිසිම idea එකක් නැතුව ඕක පිටින් බොනවා glass හදලා. Now protein intake is too much. Now protein is not for energy, it is for building up the structure. හැබැයි muscles හදන්න පුළුවන් rate එකක් තියෙනවා. ඒක තත්පරයකට ඒක අපි ගත්තොත් මොකක් time duration එකේ muscle එක grow වෙන්න පුළුවන් ප්‍රමාණයක් තියෙනවා. ඒ ප්‍රමාණයට sufficient amount of protein ගත්තාම ඇති. ඒ ගැන කිසිම idea එකක් නැතුව instructor ගෙන් අහන්න නැතුව. right? YouTube එකෙන් බලලා glass හදලා අර ටින් එක ඉවරනකම් බිව්වට පස්සේ අන්න protein content එක high. But 40% the supply is too much. Right? But the utilization by the body is very much less than the supply. දැන් මොකද කරන්නේ? අර ටික යවන්න ඕන. Too much for the body යවන්න ඕන. right? right? ඒක හරියට දැන් අපි හැමෝටම කන්න පුළුවන් ප්‍රමාණයක් තියෙනවා නේද? දැන් මොන ඥායම අරන් කවුරුහරි ඥායම කියලා දෙනවා. කනවා. තවත් කියලා දෙනවා. කනවා. right? ඒක ලෙවල් එකක් වෙනවා. ඒක දිහාට තව කන්න බෑ. මුල්ම කාලේ ඉවරයි. එතන අපි ඒක සස්පින් දාන්න දෙකයි. කන්න බෑ. right? ඒක protein intake එක too much now. Right? There's nothing that the body can do. Body can't keep it stored so that it can use in the future uses. No, that is not possible. So that has to be excreted from the body. Right? So then high protein diet can no. Right. And there's another clinical situation called GI, gastrointestinal bleeding. Right? Intestinal tract can bleed well. Right. In that situation. And catabolic status like fever, burns, right? Right. Then after we take the blood report, we have to talk to the patient. And after we get the medical report, we go to the doctor and we show that to the doctor and we discuss, okay. So then the doctor has to discuss with the patient considering these factors. Just because the nitrogen level is high in the report, the printout, we can't say that particular patient is suffering from kidney pain. Okay, so then high level of nitrogen is obviously kidney failure. But these factors have to be, these are the, like we call them, clinical interpretation. Right? So we should know about this stuff, right? Then the patient, we have to talk to the patient and find out exactly whether these situations were there. Right? Right. Decreased urea level, liver failure, malnutrition, overhydration, low protein intake, right? Okay, so then urea level, there's a expected urea level. That can be low also, right? We feel like, okay, it's harmful when it's high, and it can be low also under these situations. Liver failure, malnutrition, overhydration, that is also possible. Like we have like when we have in water a lot more than expected. That is the answer. And low protein intake. Right. So, just like in the glucose test, we have to be like really mindful about certain stuff, about maintaining the quality of the experiment. Right? We have to use the fresh reagents, not expired ones. And we have to be mindful about the calibration of the instruments, right? Calibration part has to be done. And the results, after we get the results, internal and external quality control, that is essential, right? Internal and external quality control means internal means, yeah, we talk about we have to maintain the lab conditions, the particular temperature, particular pressure, particular regions, and external ones. Then from the place where the blood sample is collected to the lab, right? External factors, right? And also uh, hemolysis. And so hemolysis, that means when we have to consider about the iron level in the blood and lipid level in the blood. So that also affects on the accuracy of the measurement result. Right. So that is a scientific background of the test. So how do we do this test? We need obviously our blood sample, the urease enzyme, that is to break down urea into carbon dioxide and ammonia. And we need Bedrock's region. What does it do? It is making colored substance by reacting with ammonia. Then we measure the color intensity. Standard urea solution. By standard urea solution, because always we have three test tubes. Remember, even in glucose test, we have three test tubes. Blood sample one, distilled water, standard non-concentration glucose solution. Here also same story. Standard urea solution this time. Right? So what's the standard urea solution? 20 milligram per deciliter or 40 milligram per deciliter, depending on situation. We use one of those two. This is still important. Spectrophotometer set at 540 to 570 nanometer wavelength range. That is to measure the color intensity. Test tubes, pipettes, timer, basics, those basic instruments should be there. We collect the sample. Like I always say, not from the arteries, but from the veins. 2 to 3 milliliters is enough. Right? So we don't need a huge amount of blood for this one. Right? And we take test tube, take it to the test tube. Right? And we let blood to clot. And the centrifuge, I was explaining about centrifuging part in the blood test. Sorry, but it is glucose test as well. So 300 RPM for 10 minutes. You also remember it was 300 RPM, 300, sorry, 3000, 3000 rounds per minute. That is for 10 minutes we do that. Right. Then after doing that, our blood sample is ready for the test. Like I said, we take 3, the blank one, right? Then the standard one, that's for calibration. And our patient's blood sample, those 3. When this table shows that how we are mixing them, right? For the blank one, we take urease reagent and distilled water. That's it. For the standard one, we take urease, that's a reagent term, and standard urea sample. And for the real one, urease has to be there, and our blood sample. Those are the 3. All the 3 we do. Then, incubation. I explained what incubation is related to the blood sugar test. Temperature 37 degrees Celsius. We keep that for 10 to 15 minutes. Right? Why do we need that temperature? Because what what's happening here is the urease enzyme is active. Urease enzyme. We know for every single enzyme, there is an optimal temperature, isn't it so? Right? For urease enzyme, so therefore, any single enzyme, there is an optimum temperature. If we don't supply that temperature, enzymatic action is not happening properly. So here we supply that temperature, then 10 to 15 minutes, during that period of time only the reaction is happening. Now the enzymatic reaction is done. Then there was a reaction between what and what? Urea and urease enzyme. It made ammonia and carbon dioxide. Ammonia and carbon dioxide. That ammonia is going to react with Berthollet's reagent and makes that colored substance. Right. Again, we incubate this for 10 minutes at 37 degrees Celsius. Right. Depending on how much ammonia was there in our blood sample, at the blood sample in ammonia urea convert kara ammonia වලට ඒතකොට ammonia ගොඩක් තියෙනවා නම් urea ගොඩක් තිබිලා නේද? Right. So we convert then we have ammonia in our blood sample. Depending on how much ammonia is present, a blue colored substance is formed. It will be dark blue. The blue color intensity will be high if there's high amount of ammonia. Again, high amount of urea will color intensity අඩුයි urea අඩු නම්. ammonia අඩු නම්. Right. So we measure the color intensity by using the spectrometric method like before. With that, we have a reference standard one also right there because we have 3 test tubes. So but then we measure the color intensity. Okay. Calculation is done like this. Right. So absorbance, the spectrometer reading of the real blood sample divided by reading of the standard solution into the concentration of the standard solution. Right? Normally, if the standard is, we say 40, in the previous slide, I was talking about like standard solution can be taken at either 20 milligram per deciliter or 40 milligram per deciliter, right? So then multiply by 40 in that case. So that's how we do the calculation. Then only we get the value. That is what is printed in the blood report. In the printout, that is the well, in this test also, we have to be careful about certain areas. Well, what if our blood sample, we have in the blood sample, we have red blood cells, white blood cells, right? We have stuff. So, I'm talking about this red blood cells. Just imagine in the blood sample, we'll say red blood cells are broken down. Red blood cells are broken down. When the red blood cells are broken down, the hemoglobin part will be there in the solution. Right? Then there will be like high content of iron in our solution. Why? We have broken red blood cells. Right. Then such a blood sample is called as a hemolyzed sample. He means iron related to them. He means science. So the hemolyzed sample. Right. That is there. And lipemic sample. If we have more lipids, abnormally high concentration of lipid, if if we are talking about normal healthy person, they are no problem. But if the patient is sick abnormally, the lipid content could be high. That's possible. Right. Then we should know, we have to be mindful whether our blood sample is, whether it's hemolyzed sample or lipomic sample. Under those two situations, our readings are going to be wrong. I mean, readings are correct. Because it's coming from the experiment, but our interpretation about the patient is going to be wrong. Right? That is the thing. And again, the reagent should not be expired. And the procedure has to be followed properly. Calibration of the instrument is really important. Right. Next test. Creatinine test. Creatinine. What is creatinine? Well, that is also another waste product. Creatinine is produced in our metabolism. That is actually, it is generated in muscle metabolism. Right? Basically, creatinine phosphate is broken to form creatinine. As usual, this also excreted by kidneys. Right? Then let's talk about how to do the creatinine test. You see, not like the blood urea hydrogen test, one test. Not only that, this test also we can evaluate the function of the kidney. We can find out whether our kidneys are functioning properly by using this test also. Right? Normally, think about that blood urea test, one test is going to be like beyond the reference ranges. Then we suspect that, okay, this particular patient is suffering some kidney issue, right? Then we have to do other kidney related test also, Then one of those is this creatinine test. Okay, let's see how to do this test. Well, again, we take serum or plasma. Well, creatinine. Remember the reference range. It changes with the gender. Right? Serum creatinine for males, 60 to 110 micromole. So if we talk about our family units, so both the units are going to be measured. Both the units are going to be there in the printout that you get in the report. Okay, medical test, right? 60 to 110 micromole per liter, or in milligram per deciliter, 0.7 to 1.3 milligram. For a female, 45 to 90 micromole per liter. In milligram per deciliter, it's going to be 0.5 to 1.1. Right? So then creatinine clearance, so that's going to be 90 to 140. But remember, this is going to depend on several factors. This changes with age, the gender, and the body size. Why is that? This is something related to the function of the kidney, right? And so kidney will be functioning. Kidney is like doing some, it's like neutralizing and removing. Kidney is like doing a very important role in the body, right? What is that? Removing harmful substances from the blood. Then from the day that we hold, kidney is working to remove the harmful substances from the blood. Because of that, what is happening? Kidney, there's like high possibility for for the kidney to malfunction, right? Then with age, performance of the kidney goes down with age, right? Health condition, basically how active you are and all, and gender and the body size. Why body size? Gender you can understand, age you can understand. Why body size? Then when the body size is huge, metabolic stuff, metabolic reaction should be proportionately should be negative. Then the amount of the harmful substances like urea and all produced in the blood also is going to be high. Then the job which is allocated for the kidneys is going to be definitely high, which means the body size also matters, right? ඒකනේ කච්චි අර slim වෙන්න දඟලන්නේ ඊළඟ එක නෙමෙයි. Anyway, so body size really depending on the body size, these ranges are going to be different. Right. So how do we do this? We can use several methods. Jaffe reaction. That is again the colorimetric method. We are using, as a reagent, we are using picric acid. Right? Okay, so what is happening? That is about the difference from ketones, glucose, and certain drugs. But anyway, basically, if those drugs, if those substances are there, our test results are going to be wrong. Drugs, ketones, glucose, like that. Because of that, we are using enzymatic methods. That's going to be more specific and less interference. It is important to have less interference in a test because then the reliability of the result is going to be high when we have less interference, right? So which is why we are using enzymatic methods, right? And there's a spectrometric method called isotope dilution mass spectrometry, right? That is by using a standard solution. We do that. Well, these are the situations with a high creatinine level. Acute kidney injury, AKI. Chronic kidney disease, urinary tract obstruction. So likewise, we have several situations. These are the conclusions. Basically, we come to by reading the report, right? When there's a high creatinine level. Well, yeah, the extreme is the other side. What is that? Low creatinine level. High creatinine level is possible, plus low creatinine level is possible. When the creatinine level is low, right? These are the situations. Under these situations, reduced muscle mass, elderly situation and malnutrition, and the pregnancy levels, right? Advanced liver disease, that is like decreasing creatinine production is going to be less. So these are the situations where we have low level of creatinine. Right? Right. Limitations. That means this test, creatinine test, is not going to be universal. Right? black glucose and all. So they are going to be different from this. When it comes to certain tests, there are limitations, which means they are not universal. So what are the things? What is going to be limiting, right? Muscle mass. I will talk about the body size, right? Muscle mass, age, sex, and dietary intake. Hmm, right. And also, there are certain like sensitive to early stages of kidney malfunctioning, right? So that is also there. That means early stages. That means like we have a particular patient is hasn't come to a level where the kidneys are not functioning. Kidneys are functioning, but now even for a heart attack, right? There are early stages. There are early stages, right? Uh, so cancer will say there are early stages. Likewise, kidney failure also, there can be early stages, right? So uh, when it comes to this side, so we talk about a medical term called estimated glomerular filtration rate, right? That is about, we know that kidneys are doing some filtering function. Exactly, like some, it's exactly some filtering function. So this rate of this filtering, what do we mean by rate of filtration? Let's say through the kidneys, we'll say the volume of blood which is passed through is, we'll say 5 liters. Right. As an example, even in a given period of time, from that 5 liters, how much harmful products, harmful substances have been removed, right? So this is what we call in simple example. Like, so that is what we call estimated glomerular filtration rate, right? So this is showing that how functioning the kidney is, right? And also another one. Uh, right. I will explain that in the next slide. Like, well, I was talking about that CKD situation before. Well, now we have two tests in total to find out whether the kidneys are functioning properly or not. The first one is one test, right? Blood urea angle test. The second one is this creatinine test. Remember, out of these two tests, correct question? No, okay. Out of these two tests, when it comes to the creatinine tests, more than the blood urea test, creatinine test is giving us like a very close idea about, okay, right, kidneys are early stage of malfunctioning, or kidneys are like almost malfunctioning, like that. So that situation is there. So remember, then in case if we have to choose between one test and creatinine test regarding malfunctioning kidneys, we select uh, the creatinine test over the blood test. Okay, right. And that CKD situation also, if I go back to the issues that we were talking about, right? Chronic kidney disease. And so basically, I'm mentioning like several situations here. So other than dehydration, of course, like very clearly you can understand. See, other four issues, right? Other four issues that is going to be like clearly identified by this creatinine test. Speaking of how to do this test, right? Again, we take serum or plasma as a sample, right? And remember, this test doesn't require fasting, right? Fasting is not required. But this is something related to the protein content. So, meat heavy meals, that has to be avoided, right? Meat heavy meals, right? So that you can eat, but not high content of protein, basically. Okay, like before, we take the correct sample and will be centrifuging just like before, just like in the previous three samples. Okay. Then after that, we take picric acid, right? And sodium hydroxide solution, creatinine stainless solution, and distilled. We know always we have three samples, three test tubes. One is our patient sample, the other one is a standard solution that is for the calibration purposes, and distilled water. This is how we do. We prepare the solution, we prepare those three solutions. Blank one, standard one, and the test one. All right, right. Blank one, picric acid, sodium peroxide, and distilled water. Standard one, picric acid, sodium peroxide, standard creatinine solution. Test one, picric acid, sodium peroxide, and serum sample. Serum sample is our patient sample. All right, right, right. Here, actually, incubation is done at room temperature. That's around 20 minutes. Okay, that is the incubation part related to this test. Then again, we use the spectrophotometer to get the reference range. Basically, the color intensity. Well, this is how we do the calculation, right? Final answer is coming in milligram per deciliter. Our test, our sample, patient sample, right? That sample observer's value divided by, we have the standard solution out of those three, or one out of those three. That value is there, multiplied by concentration of the standard solution. Right. Then we get the final answer. Correct. As usual, in this test also, we have to manage the standards. Otherwise, the final answer is not going to be accurate. So, run low and high level of creatinine control samples with every batch. That is for the calibration purposes. Low level of creatinine and high level of creatinine. So then when we have both the extremes, then it is easy for us to figure out where are our blood sample of where the patient's blood samples are going to be lying. And the photo spectrometer has to be properly calibrated as usual. Yeah. Okay, right. This is how we do the creatinine test. Well, next one in line is cholesterol test. Right. That we will continue in our next class. Right. And that will be our final lecture, and after that we will be getting a study leave, basically duration for study, so that I will confirm after discussing with the manager. Then accept. This is going to be your results file. Did you ever sign this one? Oh, thank you. Two papers. Mình phải hiểu được. Mình là gì đấy? Right. Okay then. See you next week.
Là chính là nó cùng nhau thì mới là
Mình với cả là tình hình mà cân nặng